We are going to be discussing in this video how to handle and prevent challenging experiences with IV ketamine. Hey, it's Dr. Ko here from Reset Ketamine. Thanks so much for joining me. So as you know, ketamine can be a game changer for depression, for PTSD, for anxiety, and chronic pain. But at the same time, it can also cause some challenging experiences that patients might be scared or worried about. So let's discuss 7 things to prevent and address this. Number 1 is having an intentional mindset. When you go into a ketamine infusion, you want to set the intention. It's kind of like putting in GPS coordinates before you go on a long trip, and having that intention will be crucial throughout your experience. Number 2 is the proper setting. So being in the right environment with the right people, somewhere where you feel safe and where you can trust the people around you to handle whatever may come up. Number 3 is dosing. You don't want either too little ketamine or too much ketamine. So if you're not really feeling the effects of the ketamine, you're probably not going to go anywhere. Conversely, if the effects of ketamine are way too high, that can be extremely overwhelming. So it's important to find that right amount. I like to call it the Goldilocks amount of ketamine, which can be custom tailored with each infusion. Number 4 is your breath. One of the greatest tools that we have available is breathe. As a matter of fact, take a deep breath right now with me. You have a large muscle that sits underneath and around your ribs. It's called the diaphragm. And when you're taking these deep, conscious breaths, you want to expand the lung capacity via using the diaphragm muscle as much as possible. What's interesting is when we do take these deep, slow breaths with full diaphragmatic breathing, that can help us calm down. So if someone is in a challenging experience with the ketamine infusion, you can definitely take one of these deep, full breaths or even several of these deep, full breaths. Number 5 is curiosity. A wise person once said, it's very difficult to feel scared and curious at the same time. So if anything scary does come up, get curious about it. Well, what does that emotion feel like? What is that memory about? Really dive deep into the possible scary, challenging experience and learn what it could mean to you. And when you're curious, that could help reduce the fear associated with it as well. Number 6 is acceptance. So during the ketamine infusion, you want to just allow, to accept, to surrender to the full experience and of whatever may come up. And there's something really powerful about acceptance. And even if it is in an uncomfortable situation, just accepting and allowing can actually help it fade away once you fully accept it. There's that old saying, whatever you resist, persists. And finally, number 7. This is really important, the post-infusion. So what are you doing afterwards? One of the things that we recommend for our patients is to have an appointment scheduled with their therapist ready to go, maybe within the next 24, 48 hours. Also, you can even take some time to journal and write down your experience. Or if you're not a big fan of journaling, grab your phone, turn on the voice memo, and just record the experience. And so these are some of the things that you want to consider to do post-infusion that's going to help you with any experience that can come up. It takes a lot of courage to undergo ketamine infusions. It's definitely not for everyone. And because of these scary, challenging experiences, it's going to take an incredible amount of courage. If you are up for that challenge and you do have the courage, know that you have these 7 tools available to you. So I want to know what your thoughts and comments and questions you have about this. So feel free to leave a question or comment below. And of course, if you like this video, please hit the thumbs up, please subscribe. And lastly, feel free to share this information and this video with anyone that you think would find it useful. Until next time, we'll see you in the next video.